Today, more and more industries are relying on crowdsourcing modeling. This model provides an effective way for businesses to collect and store data via the internet from a number of people assigned to do each task. These data are labeled by experts and now amateurs, in which the computer's algorithm will determine the truth of these data and categorize them based on the results. In the medical field, crowdsourcing allows this field to open up its doors to many other experts in different fields. This brings people together to help solve problems that cannot be done by physicians alone. When experts of different fields and the public is brought into the equation, it makes everything a lot easier because the experts can use their expertise in their field and solve complex problems together.
Machine learning is a method for understanding data with minimal interference. It is a way for researchers to understand their data through their data. Machine learning creates an algorithm that produces a model by using patterns provided in the data. Machine learning can be used in almost any industry. People have used machine learning to beat levels in video games. It is used in marketing and, of course, in data science. Machine learning allows us to learn from our data at a rate and efficiency that is unattainable by humans. In regards to public health, machine learning is extremely beneficial because public health data is usually at a macroscopic scale, meaning that the data sets are huge. By using machine learning algorithms, it is likely that these algorithms will be far more efficient at extracting small and large-scale patterns in data than a human. For example, let's say a data scientist wanted to see if there was some correlation between the rate of lung diseases related to smoking and the number of non-smoking ads presented on TV. This would be a difficult task to accomplish by hand. Instead, the data scientist can input the data and let an algorithm work out the patterns in the data itself.
Machine learning in public health. Now, in regards to public health, researchers are faced with massive sample sizes and often is too much data for any person to do alone. Now, this often results in data being too old to be effectively used to predict future events. Now, machine learning can help organize the collection, labeling, and sorting of this information to help provide new and current data. Now, with such large populations that need to be addressed, a way to organize all the information would be crucial. Now, machine learning will take the role of organizing any information out of the hands of researchers and into those of the computers. So researchers can now focus on how the data can be used to predict future events. Now, machine learning is not specific to public health, but it can be applied to in a variety of ways. In a previous video, we talked about how researchers for the opioid crisis today are faced with using old data which cannot effectively predict future events. Now, machine learning can help mitigate this problem to provide more current data.
Healthcare algorithms have been a recent innovation in healthcare, and the new generation of machine learning has the potential to provide information about diagnoses and assist in treatment in general. But sometimes this brings about challenges for regulation and development of the algorithm. And recently, there's been a significant racial bias found in a software program, and this is because they were using healthcare costs to determine patient risk, and from this, a racial bias arose, giving Black patients a harder time to seek care, even when they're in worse condition than white patients. And this just goes to show the structural inequalities that were shown in the healthcare system. But by accounting for this problem and correcting the healthcare disparities between Black people and white people, it was observed that the percentage of Black people in the automatic enrolled group was it increased from 18% to 47%. And my opinion about this is that the algorithms aren't bad, because in the past we've seen algorithms as the fundamental basis of computerized tasks, but they need to be improved in order to accurately provide care to those in need.